Hi friends, how are you all? Hope you are doing well and fine. Today we will discuss one of the important another topic in Nclex-RN exam. And this is not only I consider as an important question in Nclex-RN exam because I have seen many questions related to this topic. It is called informed consent, and most of the time the options are based on informed consent questions are a little bit confusing. So I thought today we will discuss some of the main points related to informed consent, and I assure that these points will definitely help us to find the correct answer choice. So shall we go to the slides? Here you can see some of the main points related to informed consent. See, when we listen the word informed consent means we are taking a consent from a client, or the doctor is taking a consent from a client after informing something. So what is that something? We'll see the main contents. Information disclosure, which means the doctor or the surgeon or the one who is doing this procedure have to inform all the aspects related to this particular procedure to the client before taking the consent. That will come under information disclosure. Then the next one is voluntariness. What is means voluntary? We are doing something voluntarily. I know, and with my will I am doing that. Then another two things are competency and comprehension. These are connected things. Whether this person or this client is the mentally and emotionally competent, or does he have the capacity to understand what all the things this doctor is explaining. So these are the things related to the competency and comprehension. So let's move to the next slide and we'll see what all the things comes under information disclosure. So when we think or when we see this information disclosure part, we should know what and who and when and where should inform. We'll see one by one. The first one is the surgeon or the one who will do the procedure is the person who will inform all details to the client. That is one thing. Because many times we might be the nurses or somebody feel that okay, we'll see some options like obtain a consent. Directly we'll go and choose that one. If we might be in anxiety, we might be in hurry, or we are not clear thorough with the topic. It's not nurse is or register nurse is the one who will obtain the consent. A nurse only witness and ensure that the patient has understand what all the things the doctor has discussed in front of him or discussed with him. Does the patient understand the language? Does the patient have the mental capacity what the doctor is explaining to him? So these are the things that nurse should ensure. Then the next one is name of the procedure or the study. So now we told that the surgeon is the one informing. So what are the things he will inform? The first one is that name of the procedure or the study or the surgery. Then purpose of the procedure, why we choose, or what is the benefit that you will get once you will undergo this particular procedure. Then the duration of the study and subjective involved. This is also very important, the duration, the word itself. Because especially for instance, like some of the ortho surgery, it consumes a long period. And sometimes it might be more than 6 hours. If some situation, maybe the patient family also know the patient is this kind of surgery and patient has undergone, because always we should ensure that if we are discussing any information with the patient family, we should have the permission from the patient. Without patient permission, we should not disclose any matters with the others of the family also. Even though they are the family, we doesn't have that right. So we should inform, okay, this surgery it might take this much time, and the patient might be in the observation unit for 1 or 2 hours again. So where the patient will come after this time, and you might be in this particular position during this procedure, and these all the things will happen during that time. These all things the doctor have to inform to the client. Then what are the risks and benefits he will receive undergoing this particular study or procedure. Then what are the outcomes and what are the prognosis, how many days days it will take to leave the hospital, and what are the things will happen usually in the post-operative period. Then the alternative treatment options, that is also very important. In certain situations, maybe because of the spiritual circumstances or background, the patient does not able to accept the particular procedure, so he also should know what other alternative option which I can choose, which will help to overcome this particular illness. That is also very important. Then the another one is use understanding language or a interpreter, which means sometimes the patient might be not able to understand the particular language what the doctor is talking, or the patient might be came from another country and now he's working in this country, and finally he end up with some medical issue, and the doctor is explaining everything, but the patient he's not completely understand. Not he will understand little bit, not that is meant. He should understand everything completely, and it should very accurate, clear everything. So in that case, we should arrange an interpreter who will translate all the information what the doctor will inform to this particular patient client. And the interpreter should not add any detail by himself or herself, should not remove any details that the doctor should inform to the patient. Because certain circumstances may be, for example, the doctor has said this surgery will take this many hours and these are the prognosis, and certain conditions you might get infections and hemorrhage, and the interpreter is adding one more point along with that. That is wrong. He or she should not do. He should only translate what exactly the doctor said. Then the other one is confidentiality. That is very important also. All of you know that confidentiality is one of the main factor in delivering a safe and effective quality care to our clients. So these are the things related to the informed part or information disclosure in informed consent. Next we will move to voluntaryness. So what does comes under this voluntaryness, the word? The voluntaryness means it should be derived from adjunctive voluntary, which means the client should sign with his own will or his own desire, and he should be take this choice by his own concept. He should not be forced or compelled by anyone else. If he or she don't want this particular procedure, he have the right to refuse. He can go with some other alternatives. So these are the main thing connected to voluntariness. Then some other factors, these are not that much important, even though we should just keep it in our mind. Age, certain situation, age is a factor that affect the voluntariness. Then socio-cultural, spiritual backgrounds. Sometimes they don't have other choices, very limited choices. Then because of the lack of money, or they cannot afford the cost of the surgery. These are some of the factors that little bit associated with this voluntariness part of informed consent. So this is the things connected with the voluntariness. Next we will move to competency and comprehension. What does it mean? We know that we are nurses while we are joining to any hospital. Prior to our contract renewal, we usually undergo a particular competency, and we have to attain this many hours for CNE and all. So we know that. In the same way, which prove that I am competent enough to do that particular work. I am competent enough to work as a registered nurse in that particular department. That is showing our capacity, our ability. So in the same way, a client or the person who will sign should have the mentally and emotionally competency level. We should check whether he have the good thought process, whether he is comprehend enough to understand what the doctor or the surgeon is talking about this particular surgery. So we will see in that concept who is a competent or comprehend person can give consent. The first one is an adult who is 18-year-old and above. If an adult, he is not an 18-year-old, or he is not competent, mentally and emotionally competent, he cannot sign. So that is the first point. Then a legal guardian. In certain situations, the legal guardian may be the one who will sign. Even the legal guardian also, we should ensure, the nurses should ensure that the legal guardian, okay, he will understand the language, he have the competency, and he have the good ability to hear. Everything we have to check. Then we have one special case in terms of competency and comprehension under the person who can give consent, that is adolescent consent, which means the person who is 16 year or more. Before we said that the common thing that the person who is 18-year-old and above. Now this is a special case, the person who is an adolescent, even who is 16-year-old or above also can give consent. What are those things? An adolescent who is self-supporting or who is living separately and he is managing all his money matters and everything by himself, then he can considered as a person who can sign the consent. And for that simply we can somebody will come to the hospital and he said that I am living by myself and I can do. No, we cannot accept. We should check the document. Okay, these are the things. Okay, he is under that category, then only we can accept. Then another one is married, like a person who is 16 years old adolescent and he's married. If there is a word in that particular question or option you see that married, just think this might be an option to select as an answer. Then and another option is that in the military. See, this is one special case, especially in United States. Those who are working as a defense, working in defense force, or those working as a military officer in the United States, he also, even though he is 16 years old, he also considered as a person who can give consent. Then another one, declared as emancipated by court. Like this is a special case, some adolescent who is declared as emancipated. So even though they are 16 years old, they also can give consent. So these are the cases who or the person who is competent and comprehend and can sign the consent. Now we will see who cannot give consent or who doesn't have that right to sign consent because of some of the factors. That is, one is unconscious. Definitely the person is unconscious, the client is unconscious, how can give? No, it's not possible. Then the person who is severe brain damage or and their thought process has altered, they couldn't give. Then person with chronic dementia, definitely he also have some thought alteration. Then the person who is under the influence of any alcohol, drugs or toxic substance, definitely he might be like drowsy and he don't know what he is listening and what is going. So in that situation also, the client or the person who will listen, he cannot give consent, he cannot sign the consent. Then the another option is that court is declared as incompetent. In certain situations that the person is not mentally or emotionally competent, the court will declare. So in that case also they cannot sign the consent. So these are the certain options who can give consent or who cannot sign the consent. I hope you understand. Am I clear to you all? If anybody want to make some certain notes, especially about the special cases, please pause and make your notes. It is very important. So next we will move it to one question. Shall we? Okay, first I will read the question. The nurse is leading an in-service about management issues. The nurse would interview if another nurse made which of the following statements? See, what do you mean? What do you understand when you read the question? See, in the situation, one nurse, she's a senior nurse or she might be a educational nurse. She is giving an in-service education about management issues, and she saw that the another nurse, she is doing something wrong or something not comes under her scope of nursing. That is the meaning of word interview. We should understand the meaning of that particular word. We should see that word. If you didn't see that word, maybe we will answer but we get wrong. The interview means, see, one person is doing something wrong and another person saw that they are doing wrong. Of course they will go in between and they will interfere. In this situation also, this nurse, she saw that the another nurse, she is doing something that is not right or that is not correct as per the ethics. So this main nurse, she will go and interview. So we are looking here for a wrong statement or an incorrect statement which is made by this, who is this another nurse. So the first option, I hope you are clear with the question. The first option, it is my responsibility to ensure that the consent form has been signed and attached to the client chart prior to surgery. How does it? Of course, it is the responsibility of every registered nurse to ensure, see here the word, to ensure. We are not obtaining, we are just ensuring that the consent form has signed. Okay, everything is fine, it's filled, it's signed, and she will attach that as a record to the file prior to surgery, which means already the client has received all the discussions part finished, and the client has understand everything, and the doctor has discussed everything. So now she is ensuring, okay, everything is fine. Okay, now she is going for surgery, the patient is going for surgery, the client is going for surgery. This is a correct statement, and this one comes under the nurse scope. So we will eliminate that one. Before I said that in another delegation topic, that always whenever we'll get 4 options, we have 1 or 2 options for elimination, definitely. If there is not, also we can just find the answer by using some other methods. Next, we'll go to next option. It is my responsibility to witness the signature of the client before surgery is performed. Yeah, that is the primary, that is the main part of the nurse. She will witness, the registered nurse, she will witness, okay, the client has understand and she signed the consent. Okay, that one also correct statement, so we can eliminate. So now we have eliminated 2 options because those are correct statement. So the main nurse no need to interfere with the another nurse because she is doing correct. Why should the main nurse should go and tell, okay, no, she should not come in between. So we eliminate 2 correct options. Now we have 2 more options. So in these 2 more options, definitely we can find one incorrect or wrong option. That might be our answer. We'll see third one. It is my responsibility to provide a detailed description of surgery. Does that right? No, not at all. We registered nurse are not the right person to provide a detailed description. See the keyword, detailed description of the surgery. No. The surgeon, the doctor, he is the one who will provide a detailed description. So it will not come under the scope of nursing, under the rights of registered nurse. So if she is doing this one, this is a wrong thing. This is a wrong statement. So the main nurse should intervene. She should interfere and she should tell to the another nurse, you are not the right person to give this description. So that is our answer. Is that clear? And we will see the last option also. So it is my responsibility to answer questions that the client may have prior to surgery. Yeah, sure. Sometimes the client has signed the consent and he receive all the explanation from the doctor and he understand everything. Even though in many cases the client, definitely they have an anxiety. They will ask many questions. So those questions, the nurse, the initial thing that the nurse should answer. And even though she answer and the patient or the client is not convinced, she should escalate that matter to the surgeon or the doctor that you explain everything but still the client is confusing with this one. Could you please explain a little more? Because this is prior to surgery. The client have the right to ask and the nurse is the person should answer. If she is not able to convince or the client is not convinced by herself or himself, she can escalate to the doctor. Doctor is supposed to explain again, supposed to answer again. So this is also a correct statement in terms of the nurse, the registered nurse. So here we will see only one wrong statement, only one incorrect statement that the another nurse is doing. That is the option number 3. So our answer is 3. I hope you understand how we select the answer, why other 3 options are wrong, and how we can eliminate, and how we will understand the questions and certain keywords, interview, prior to surgery to ensure. So just practice more questions and try to discuss some questions with your friends so you will get more idea. And if you like our video and the way we are discussing and the topic is clear, please share with your friends and subscribe our channel. So fine, take care and be happy. Have a nice time. Bye. Thank you.